Hello, my name is Daniel McGrath, and I am presenting on a case study that included drama therapist Jay Vaughn and his use of Centray with Colette, a 13-year-old in an orphanage system who often did not engage verbally with adults, with a history of running away from her place of care and hiding. It is my aim to illuminate the use of Centray in psychotherapy, the theory behind its use, and identify specific techniques that may aid the use of Centray with certain populations. Studies have shown that Centray can be used to facilitate psychological processing and identify solutions through the symbolism of the figurines used, guided by the conscious mind to make sense of the unconscious images the participant uses, as Cook contends. Colette began to offer her thoughts when therapist Jay was sitting with her for quite some time in silence. This silence could have been seen as Evans et al. Contend, supportive silence. This supportive silence is appropriate when a patient client is deciding something. In this case, supportive silence was given initially for Colette to ponder her first meeting with the therapist. Space was given for her to share when she was ready. Such attending behavior was a wise choice for Jay to make as a clinician, especially given Colette's behavioral patterns. At this stage in the therapeutic relationship, it would be hard to diagnose her with something based solely on absconding and avoidant speech. Social context does, however, shed light on Colette's presenting behavior, as she was removed from her family at the age of 5 for physical and sexual abuse. With more information, a differential diagnosis I considered may be acute stress disorder or post-traumatic stress disorder due to her, quote, direct or indirect exposure to traumatic stressors involving actual or threatened death, serious injury, or sexual violence, as posited by the American Psychological Association, the DSM-5. Jay's curious questioning may have allowed Colette to clarify the associations she made when she shared that she never felt happy. He makes a suggestive comment about how a lot of things happen to young people when they are little. A lot of bad things happen to young people when they are little. This may have opened a door for Colette to think about her past, something that Jay is aware of, and uses it as an offer in order to encourage Colette to think about her early memories. Because Jay is working from an informed approach, knowing some of the feelings associated with trauma, Jay asks what feelings she has been experiencing most often, and supports her answers with a bit of psychoeducation. This, in turn, prompted a connection that Colette made between her feelings and her behavioral patterns of running away, with the flight or freeze system, giving an exploration around her feelings as it connects to her behavior. I believe this approach allowed Colette to be even more understood or reflected, which is a therapeutic process vital for the therapeutic relationship. Jay softly suggests the idea of using a Centray with her after she glances at the object. When she looks at it again after some time, Jay encourages her to use it, offering her to give it a try. Noticing Colette's gaze multiple times informed Jay to use what shows up in the here and now, titrating her interest in the Centray and maybe giving her agency to choose her own way of processing. This also raises the idea that the invitation for the client to explore the tray and the figurines available is an opportunity to reassure the client that there is no right or wrong way to complete a tray, something Garrett suggests strongly, especially with adult clients. Later, as Colette began to create her scene, she used multiple figurine babies, among other things like monsters and figurines of that sort. The ability and the availability and quantity of figurines, even if they are of the same classification, highlights the importance of having multiple quantities and qualities of figurines available for participants to associate with. Jay then noticed the physical responses coming from Colette as she created her tray and asked her about her movements. This curiosity led Colette to share the sensations in her legs that she associated with the memory of her scene, helping to bring an understanding of how her behavior is linked to her traumatic memory, and how when the feeling of fear is felt, the neurological response pattern is activated in her to run. So the clinician's ability to notice somatic responses, among others, aids the client in connecting the subconscious story to their behavior, if such noticings are shared with the patient client. While this case does not summarize how the particular session or sessions over time came to a close after Colette shared her traumatic story, I would hope that Jay, the therapist, assessed a need with Colette and reviewed what further actions they could take together in her care in order to reassure the patient client in what can be done about their memories, emotions, and physical responses to them. Or rather, the pathology that comes about, the presenting behavior, This step in planning treatment contributes to the strengthening of the therapeutic relationship, which can provide a sense of hope, as Shadler and DeMonico posit that hope is paramount to the therapeutic change. This case study not only highlights how the use of Sandtray helps to facilitate unconscious stories, but also reveals how a skillful clinician can appear when they are approaching from curiosity, when they are direct, when sharing their observations and questions about their observations, and when they keep it simple. From this case study, there is a basic outline that I suggest for when one chooses to incorporate the Sandtray technique in the future. So step 1 involves understanding the patient's client story. Any psychological assessments. Step 1 involves understanding the patient client's story so far. Any psychosocial assessments, the identities that they hold and claim, and an understanding of how their presenting behavior or pathology is identified is important. This aids the client in knowing what behavior or pathology is This aids the client in knowing what behaviors to assess over time and helps to be aware of anything that may be triggering to a client, although triggers are unavoidable. Step 2 would be for the patient client to get acquainted with the tray and figurines. Dr. Kristen Long asserts that aesthetics matter, and I think that the nature or aesthetics of the space is critical when using projectives, as it can spark curiosity in a patient. If some settings make it impossible for physical Sandtray visibility at all times, it may be best for the clinician to plan to use it in a particular session, it may be best for a clinician to plan to use it in particular sessions. Digital Sandtrays might also be of use when offered, and if it can be a solution to not having a physical one. If in a group, offering the participants the time to touch and sort the figurines into classifications as a collective or in small groups allows them to agree on the communal sorting process, as Katz puts it, where they can begin to feel resonance with particular items and may enter into a dialogue with each other around proper classification, which also shows team building and how they relate socially and communicate socially. which the therapist could also pick up on in noticing how patient clients interact with one another, which also would help inform their stories that show up in the sand tray. Further, it may be best practice to invite them to join in touching the sand and for the clinician to also join in touching the sand, assessing the ways they respond behaviorally to their comfortability. And if the offer is rejected by the client to explore with sand tray or explore further, then the therapist must respect that decision and decide how else to contain the experience in the moment. Next, the client should, according to Califf, the therapist should, according to Califf, offer prompts that are as non-direct as possible to allow the client to interact with the sand and figurines as they feel led, but still sharing any noticings or questions around what the participants might express to facilitate the exploration of the story that may arise. And finally, time to reflect on the story with any meetings that come up and offer space for the clinician to assess for needs that can be co-created further with the patient client is important, as the sand tray offers a container, physical container or symbolic container of what comes up for the client to explore maybe more safely their story and find a way of healing. Thank you.